Life in lockdown. These deserted London streets tell a story repeated across the world, as almost half the planet is now living inside. In just a matter of weeks, our life has changed beyond recognition, and yet every day the number of dead keeps climbing alarmingly. So in this Channel 4 News special, we go beyond the news and we bring in global expertise to answer the following question. When are we going to flatten that curve? Could we become the next Italy, Spain, or even America? In every house, on every street, in every neighborhood in this country, people are asking the same questions. When will this end? How can this end? And if and when it does end, what will the world look like? In other words, what next? It's barely been 2 weeks since the beginning of the lockdown, and it already feels like an eternity, which we're all having to get used to, including my family in this house. I have 4 kids at home. 2 of them have had their A-levels and GCSEs cancelled, and they keep asking me the same question every day. When is the lockdown going to end? I simply don't know. I don't think anyone knows. And meanwhile, the conversation around the dinner table is like no other conversation that we ever used to have. How many ventilators are there? How many tests are there? When are we going to reach the peak? This is a new vocabulary for a completely new reality. So here's the question. How is our government doing? A few weeks ago, we were all living lives we probably took for granted. A day at the races, dinner out, a quick pint, exercise, all parts of normal British life. And whilst the coronavirus had shut down much of Europe, Britain was arguing over an apparent policy no other country was adopting.
The only way to stop this epidemic is indeed to achieve herd immunity.
Okay, Thomas Perry, you're shaking your head.
This is crazy. So we're saying we want to kill 200,000 people in the UK?
Days later, the Prime Minister asks us to do this.
Now is the time for everyone to stop non-essential contact with others.
Not everyone understands the message. Then the ask quickly becomes an order.
Stay at home, protect our NHS, and save lives.
Lockdown is now our new normal. Only essential shopping or travel is allowed. Britain's way of life on hold. And of course, there's this sort of grim international competition going on. How are we doing compared to other countries? Are we testing more or not? And why not? How many deaths do we have compared to others? Once upon a time, I'm talking about mid-March here, we thought we were 4 weeks behind Italy. We were wrong. Italy's national lockdown happened on the 9th of March. Ours came 2 weeks later, but at virtually the same point in the epidemic. Since then, our rate of new cases has slowed to a daily increase of around 22%. In larger European countries, cases are starting to level out, while in the United States, the daily increase is almost 33%. The death rates, however, tell a mixed story. Italy peaked before any other European country and now has almost 14,000 deaths, an average of 234 per million. The UK has 38,000 cases and just over 3,600 deaths. That's an average of 53 per million and climbing. Germany, by comparison, has more than double our cases, but about a third of the deaths. That's an average of just 13 per million. So why is Germany faring so much better than others? It started this crisis with around 30 critical care beds per 100,000 patients. Italy just about coped with 12 per 100,000. The UK had just 7, and it was that fact, coupled with the explosion of cases in Italy, that made the government realise that without a full lockdown, up to 250,000 Britons could die.
I can announce that this weekend, the first of thousands of new ventilator devices will roll off the production line and be delivered to the NHS next week.
We now have around 8,000 ventilators, and we're told thousands more are on the way. But to slow COVID-19 spread, you need something else.
Test, test, test.
The World Health Organization is urging all countries to ramp up its testing to identify and isolate new cases. But the UK is only testing around 50,000 people a week, while in Germany it's being ramped up to 500,000 a week. The US has now tested over 1 million in total, but previous inaction leaves it in the epicenter of this crisis.
This is going to be a very painful, very, very painful 2 weeks.
It now has more cases than any other country. COVID-19 seems to pay even less attention to politics than it does to borders. We're all at the mercy of pure arithmetic. What then is the perfect combination to ensure as little deaths as possible, and how much longer must we all live in lockdown? Well, joining me now are three professors of global health. David Heyman is Distinguished Fellow at Chatham House. He led the World Health Organization's response to SARS and has been advising them on coronavirus. John Edmonds is Professor of Epidemiology at the London School of Hygiene and Tropical Medicine. He works on the mapping of infectious diseases and is currently advising the government here. And Devi Sridhar is Chair in Global Health at Edinburgh University. She has worked with a number of UN and government agencies in developing countries. John Edmonds, if I could start with you, if I may. We had a similar program 3 weeks ago, which you were on, and you said at the time that actually, let's listen to what the scientists are saying, but, we don't need a full government lockdown yet. We don't need to lock down the country. And then a few days later, the government decided to do just that. Do you think that the government squandered some precious time that the Chinese had bought us with their own lockdown?
So I think from a purely epidemiological point of view, the best thing for us to do would have been to go into lockdown in January and then stay in lockdown until we get a vaccine, which might be a year from now or longer. But that's not the best thing to do for the country. We've been in lockdown now for about 10 days, and it's really starting to drag, I think, on many people. And so you do have to time these sorts of interventions properly because you have to try and keep people with you. And that is what I was saying in our interview a few weeks ago, and I still maintain it. I
think you said on Wednesday that we're beginning to see this lockdown having a positive effect. Can you tell us more about that?
Yes, it looks like it. And we could compare how many contacts people make now, or are making now, with how many contacts they normally would make if there wasn't an epidemic. And from that, we can infer what the reproduction number is likely to be. So this reproduction number is the average number of secondary cases each case generates. And we think it's now below 1, which means that the epidemic should start to peak. So we won't see it until probably next week. You'll start to see an effect. So this is when we think you'll start to see these data starting to peak. That doesn't mean the epidemic is over, though. It just means that we've stopped it from growing.
Okay, let's bring in Devi Sridhar. Devi, and are we now on the right track? The curve is beginning to flatten. Do you agree with that assessment?
Well, I think, what we are hopefully seeing is that people are complying with the physical distancing measures. So what you would expect to see is, of course, a slowdown in transmission and staying within NHS capacity. The worry is that actually we do want to get out of this kind of lockdown situation. It's not good for society. It's not good for the economy to be in the situation we're in. And so what happens when we release the lockdown and we go back to somewhat semi-normality? Is it going to mean that the spread increases again? And I worry that we'll be stuck in an endless cycle of lockdown and release, which is basically going to be dictated by how NHS capacity looks.
What will that kind of lockdown on again, off again do to our society?
This tears at the social fabric because, the thing I think about is every day in lockdown, we're having kids who are not in school, not getting an education. You're widening inequalities, so you're having children falling into poverty. We're already seeing a steep rise in the demand on food banks for things like bread and milk and basic necessities. You're seeing, a rise in, calls for domestic abuse and women needing support, child abuse. I mean, there's all kinds of knock-on social effects.
John Edmonds, I wonder to what extent the government is thinking that there comes a point when the benefits of this lockdown, of these really quite stringent social measures, are going to be outweighed by the negative effects on our society that Devi has just outlined?
Well, I think they're trying to monitor that all of the time. So there is a balance that needs to be struck here between the lockdown, which is the best thing epidemiologically for this virus, and everything else in society. And this sort of very long period of perhaps intermittent lockdowns, that's exactly what's going to happen. That's what we're in. We're maybe 5% through this epidemic so far. So we've got a very, very long way to go.
David Heyman, you've got a vast amount of experience when it comes to dealing with epidemics like SARS and Ebola. Looking forward then, what's next in all this, do you think?
Well, the next is a good risk assessment by the government, which they'll be doing. And they now have the ability to do antibody testing in communities to determine what really has been the spread of this virus during the preceding months. Information that John, for example, needs in his modeling activities to better understand what is really going on. This is a new organism. We don't know its destiny. We don't even understand completely its transmissibility.
One country that's been mentioned an awful lot is South Korea. This is a democracy, a very proud democracy. It's also a very affluent society. They had a very large number of infections at the beginning, but a relatively small number of deaths. What have they done that others haven't?
Well, South Korea recently, maybe 3 or 4 years ago, as you'll remember, had a major outbreak of MERS coronavirus, of over 300 people infected from this one person who entered. They had a lesson. They learned that lesson, and they prepared for the next one.
Finally, to all three of you, a very brief question with hopefully a brief answer. Where do you think we will be by the end of the summer? David Heyman.
I don't know where we'll be, and I think it would be false to say we do know. What I do know, though, is that other respiratory infections decrease in transmissibility in the summer months, and hopefully this infection will do the same.
John Edmonds?
I agree. I think we can't say with any accuracy where we'll be at the end of the summer. I don't think that the summer holiday, that warm weather is likely to reduce the transmission of this virus. It's spreading very effectively in lots of warm countries around the world right now, so I don't think that's going to be our salvation.
And Devi Sridhar, finally to you.
Well, I'm going to give an optimistic scenario that we actually hopefully have an antiviral. We have a lot of repurposing drug trials, and so actually we can have a better treatment to offer individuals who are very ill.
Wonderful. Thank you very much for a bit of optimism there. Devi Sridhar, John Edmonds and David Hayward, thank you to all three of you. A note of optimism there, but there could be months of struggle first. No more so than in America, fast becoming the epicenter of the outbreak, and where Donald Trump described himself as a wartime president, vowing total victory over the virus. Well, one man who knows all about America going to war is retired 4-star General Stanley McChrystal, who served as commander of US and NATO forces in Afghanistan. He's now advising the city of Boston in its response to the outbreak. Let me start off with a kind of poignant comparison for you. Does this remind you at all, this crisis, of the kind of wars that you've been dealing with in the past?
Well, in many ways it does, on several levels. First, we're dealing with an amorphous, viral-like enemy that seems to be everywhere. It's not, but it seems that way, and it's hard to get your arms around it, and it's frightening. And the second thing is it takes a whole-of-nation approach to combat this, just like insurgency or terrorism. You don't fight it with a few military people. You fight it with an effort that's diplomacy, economics, social, and then a part military. So it's really got to be a whole-of-nation. In fact, I would argue a whole-of-globe approach.
We just heard from a bunch of scientists that this lockdown could last for a very long time, albeit in slightly different versions. Is the real war that we're fighting here one with our own expectations? And how tough is that?
The lockdown, or versions of social distancing, as they call it, is the only thing ultimately that will flatten the curve and give us a better outcome. And yet that takes every single individual to make a conscious effort every single day. In some ways, that's actually good for the nation because I studied the Montgomery bus boycott in the 1950s, part of the American Civil Rights Movement. And what they found was strongest was when they asked people involved to do something every day that reinforced their support for the cause. I think the worst thing we could do is tell people, go about your lives, don't worry about it, we'll let the health care professionals deal with it. This gives us a sense that not only is it affecting us, but we can all do something for it. It's not monumental, but social distancing is a sacrifice.
You know, you were a general in Iraq and in Afghanistan. These were societies that, you know, America and, you know, the West wanted to reshape to some extent in their own image, and it didn't work so well. To what extent do you think this particular war against the virus will reshape our societies, and what will we look like at the end of it?
I think this is just going to reshape us more than we think it is. I know in the work realm, now that people in the United States are working from home largely, many organizations are finding that a large part of what they do can easily be done from home. So in reality, I think there's not going to be a return to the status quo ante. I think we're going to go to a new normal. And those organizations that adapt quickest, they're going to be very, very advantaged as we go forward.
Now, much of the focus has, of course, been on the NHS. And just a few weeks ago, the Prime Minister told the nation that this was like a war against an invisible enemy. But many NHS doctors and nurses feel that they've been sent into battle with guns, but just not enough bullets, such as the absence of widespread testing and PPE gear. That was their fear back in mid-February, before the storm had even broken. Now, as we fast approach the eye of the storm, that is still their fear, as we found out. In an exclusive survey for Channel 4 News of more than 280 NHS workers, loud and clear yet again is the lack of PPE. 80% told us that they don't feel they have adequate personal protective equipment to keep themselves or their patients safe.
Run out on every shift, having to reuse masks and visors.
A thin plastic pinny and a surgical face mask is a joke and not up to World Health Organization standards.
Despite all those government assurances that PPE is getting through, almost 2/3 of staff told us
schools sent goggles and made face masks with a laminator.
I pack my dad's mask he uses for building just in case.
We have no faith in the NHS supplies, so have tried to source stock privately. One order is due to be shipped directly from China for visors and masks.
And without that vital protection, this is what they all fear: getting and spreading the virus themselves. Nearly 1/3 responded that they'd had COVID-19 type symptoms and gone into isolation.
I had flu-like symptoms and a cough and was advised to come in.
And I still have symptoms after 10 days, despite returning to work and being denied a test by management.
And the trouble is, without testing, who knows whether they've actually had it or whether it is safe to return to work. There's been much criticism of the government this week, and in our survey, 87% told us that testing still wasn't freely available to them. The NHS organisations have told us that over 30 million PPE kits have been made available to frontline staff, and that new guidance for its use has now been issued. Well, joining me now are two NHS doctors, both of whom demonstrate the danger faced by frontline medics in the current crisis. Dr. Claire Gerarda caught COVID-19 but has now recovered. Her staff are working at the new Nightingale Hospital in the capital. And Dr. Sonia Adesara is on call today at her North London hospital. She has just returned, having been in isolation after also showing symptoms of the virus. From your point of view, what's next for your part of the NHS? Claire, you first.
Well, what's next is bringing testing into primary care so that we can at least start testing our staff, our community care staff, our primary care staff, because at the moment we're losing staff through isolation and through possible illness. So for us, hopefully that's what's next.
For me, it's not about what next, but what should already be happening. I think we need to make sure that all healthcare workers working in the NHS and in our social care system have the adequate protection. And then, yeah, I completely agree. We should be testing workers who get symptoms or have been in contact with symptoms. And I'd like to see testing more wider than that as well in the community as well.
Imagine a world where you actually have all the testing that you need and you've got your PPE kits, but the virus is still there. We still haven't got a vaccine. What do you think the burden on the NHS would look like then, and can we cope?
The biggest burden for the NHS is when we have too many cases coming in and the NHS becomes overloaded. And then, as Claire mentioned, other aspects of care then get jeopardised because of that. People will continue to get ill for other reasons over the next few months, and it's really important for us in the NHS and that the rest of the service remains open, and that whether it's people's mental health problems or women having babies or people getting their cancer treatment, all these things need to continue. We can't compromise care in those other areas either.
I mean, there was an argument even before this crisis about the sustainability, and the future funding of the NHS. If the NHS has to be, ramped up to this kind of almost warlike footing on a perhaps permanent basis, how is it sustainable? How can it be funded? How can we deal with it?
What we're doing at the moment is we're ramping services up in order to meet the crisis that we've currently got. 4,000 intensive care beds at Excel isn't something that's going to have to be required for much longer. But if you say fast forward, where will the NHS need care? Well, I think what we're seeing now is how important it is to bring together the various bits of health and social care, primary and community care, mental health and physical health. And I think what we're going to probably do, and I'm very optimistic, is when we come out of this, we're going to have a much more efficient and much safer and higher quality NHS, because with those bits that we've been trying to change for decades, are being changed now in the space of 3 weeks.
Dr. Claire Gerardo, Dr. Sonia Adesara, thank you very much indeed. Well, ask any epidemiologist, any virus modeler, any global health expert what next for the coronavirus, and they will all inevitably say America. And the front line there is New York City. I'm joined now by Alicia Spiegel. Tell us about the situation in the hospital where you're working as a nurse.
So basically most of our units are now COVID-19 units. It has taken over pretty much the whole hospital. We stopped all of our elective surgeries. The emergency rooms were swarmed. And there are other facilities that are running out of supplies and also running out of ventilators and medication at this time.
Do you have enough protective gear?
Technically, we don't. We are being asked to reuse our N95 respirators for a week. We don't have enough masks. We don't know if these masks, after one shift, even work. So how do we know they're going to work for a week? They're supposed to be single use for each patient.
I can hear your children in the background there. You're a working mother. You're a nurse on the front. No, that's fine. That's fine. You're a nurse on the front line. I mean, you must be exhausted.
Yes. So shifts are hard now. It's a lot. We're working 12, 13-hour shifts, not drinking, not eating, because we don't want to take the masks off. It is terrifying.
How long do you think you can go on for like this?
Me personally, every shift I leave, I say I'm not going back. And I keep going. I don't know. Mentally, I don't know. Mentally and physically, I'm not sure. But we have to do it, and we keep showing up to do our job.
You were probably too young at the time, but I don't know if you've talked to colleagues about what it was like in New York City after 9/11. Is this as bad in terms of dealing with the chaos and casualties, or is it worse? What's the comparison?
I was 16 when 9/11 happened. I wouldn't know. I don't know how to compare it. I would compare it to a chemical warfare, almost, in a way. This is bad. This is scary. This is silent. You don't see it. 9/11 happens, it happens in one shot. This is lingering. And now they're saying over here in the States, they are doing the mandatory lockdown for another 30 days. It's not going to be 30 days. This is going to last a few more months.
Now, we all know what we want that next to be. A cure, immunity, a vaccine, something to liberate us from this seemingly indefinite lockdown in our homes. But how imminent is that? In labs around the world, scientists are racing to develop a vaccine to halt the spread of the virus. Here in Porton Down, they're already testing one on animals. Vaccines developed by Oxford University and Imperial College could be trialled on humans in the coming weeks. Work like this is happening in around 35 research centres across the globe. But even if one of the trials is successful and approved, the challenge will be getting it out there to those who need it.
El cargador del señor.
Countries will be competing against each other to get hold of the drug. Most scientists agree a vaccine will only be available at the earliest next year. So will we need to be in lockdown until then? Or could we use existing medicine to treat the virus? An antiviral drug used for Ebola and an anti-malaria drug are being trialled, but we need more tests before we know they can treat coronavirus patients. So back to where this all began, Wuhan in China. People are now slowly emerging from more than 2 months of strict lockdown as new cases have dramatically fallen. Will there be a second wave of infections? With the reassurance of a vaccine still months away, the world will be watching closely. Well, to discuss what's next in the search for a vaccine, I'm joined now by biosecurity expert Dr. Ngozi Orundu, who provides technical expertise on infectious disease control to organizations such as the World Health Organization, and Professor Robin Shattuck from the Department of Infectious Disease at Imperial College in London. He's leading a team there developing a vaccine for the virus. Let me start off with you, Robin. Tell us where we are with the vaccine.
So we're working very hard to try and get our vaccine into clinical trials by the beginning of summer. And together with the group in Oxford who will be starting earlier than us, that means in the UK we have 2 candidates that hopefully can start to impact on this epidemic later in the year.
But for those of us, living in lockdown, which is, almost the entire planet, we're impatient. So we want to know why it can't be done any sooner, why you can't have a vaccine, let's say, in the autumn if you're testing it on humans in a couple of weeks from now. Could you just explain that to us, please?
Well, I totally understand people's impatience, and we're impatient ourselves. But, traditionally, you have to bear in mind that actually going from starting to test human vaccines to getting to something that has demonstrated to be safe and works and gets a marketing license can take up to 3 years. So we're trying to do this much faster than it's been done before. And it may be possible that some of these vaccines could be used in the winter before they're licensed if they're shown to have some degree of efficacy. And that would be faster than it's ever been done before.
Let me turn to you, Ngozi Orundu. You dealt with the Ebola crisis in Africa, which is, a different beast altogether, I guess. But if we don't get a mass vaccine by the beginning of next year, do you think that that means that we have to live in lockdown on and off until we get that vaccine?
Well, while the vaccine is definitely the end game, meaning, we won't have to do as many extreme measures or totally change our lifestyle until we get the vaccine. Before then, there are definitely things that we can do. We can increase our testing and make our testing more targeted. So we're able to find new cases, isolate them immediately, look for their contacts, and then make sure that they're isolated if they're sick or quarantined for the incubation period. Then people will be able to go back to work, go back to school. And this, of course, will be after, we get over this peak. So I think that before a vaccine, we will be able to still do some epidemiological public health measures to control the outbreak, but we won't go back to normal without a vaccine.
But essentially, this sort of abnormality that's become the new normality will continue, off and on until the beginning of next year.
Yeah, I think that's very possible. I also think it's possible for us to kind of see lockdowns in cycles where we lift, the lockdown gradually. And then depending on, the number of cases and the NHS capacity, we may have to do some types of lockdowns kind of in cycles. Another thing that we will definitely have to keep doing is just social distancing. I think that really needs to become a part of the culture, as well as, increased hand washing, staying at home when you're sick. There are a lot of things that we can do before the vaccine comes out to try to protect as many people as possible.
Robin, let me ask you, if we do get that vaccine that works, and you seem to be mildly optimistic that we'll have it, at some stage at the end of the year or the beginning of next year, is that the end of COVID-19? Are we never going to have to talk about this disease ever again because we'll have the vaccine?
It will certainly be a game changer, but I think there's an important point to make, actually, even before we get to a globally available vaccine. And that is, along the similar lines to the Ebola outbreak in 2014, if either of the two vaccines in the UK, or hopefully both, get an early sign of efficacy, they could be deployed in the UK early in the winter. So, for example, we know that we could manufacture 5 million doses by early winter. And if there was an efficacy signal, those could be used to vaccinate vulnerable populations and frontline workers. And that could actually have a profound impact on the epidemic.
And if we get that vaccine and it works, will we ever have to talk about COVID-19 ever again?
I think we will, just like we talk about the flu every year, and we talk about, people get colds every year. I think that coronavirus eventually will be throughout the world, and we'll really have to make sure that the vaccine is within immunization schedules, that it's available to the most vulnerable in our population. So definitely the elderly and other populations as well. And then we'll just have to manage it as we manage so many other diseases. So
let's face it, we're all so busy trying to live our new lives and managing our fears. We've had very little time to imagine what things will look like once this is over. Perhaps everything from how we play to how we work to how we interact with each other. This is existential stuff. So time to call in the poets. George the poet, in my garden at a very safe distance of over 2 meters. But first, an extract from his brand new poem about this virus.
Coronavirus is a global crisis. We're going to have to stay home to fight this. Indoors with our phones beside us. Literally left to our own devices. Don't you find it strange? A second ago, our biggest stress was climate change. Now we face a more immediate threat. It's more lives in danger.
Tell me what went through your mind as you walked through empty London.
I was thinking of that song, man. This town is a ghost town. It's like, I have never seen London so vacant in some respects. To know that we're all thinking and worrying or questioning the same things is surreal, but there's something a little bit charming almost, in a romantic sense about it, but at the same time.
Because it unites us all, or?
Yeah, it's rare to have so much of humanity on one accord.
We talk about this virus as a great leveler, but rich people are going to do better, aren't they?
Right, so already there are differences in how people are able to respond to the fact that we can't go to work, right? Poorer families will inevitably be more affected by this. There are pressures within overcrowded households. So these divisions won't disappear because of coronavirus. If we're not careful, they could be antagonized.
You talk about the importance of telling stories and how we survive this crisis through the kind of stories that we tell each other. What's going to be the role of the arts in all this, do you think?
Well, I see art as a torch, right? Shining a light on our experiences. I feel fortunate to be part of an arts culture in this society that really takes that role seriously. Arts Council England recently announced a £160 million package, emergency fund, to provide relief for artists on an individual level and an organizational level. And that's the kind of thing that will really prove a worthwhile investment, a social investment throughout this crisis, because arts is the space of storytelling.
George the Poet in my garden on what next for our souls. But what about everything else? Geopolitics, geoeconomics, geofood, global leadership, the big issues. Well, joining me now are Tim Lang, who's Professor of Food Policy at City University. He's worked as a consultant to the World Health Organization and also as a hill farmer in Lancashire. Gail Smith was Special Advisor to Barack Obama, where she helped coordinate the US response to global health threats, including the 2014 Ebola crisis. She now heads the One campaign, a global movement to end extreme poverty and preventable disease. And Inger Andersen is Executive Director of the UN Environment Programme. The Danish economist and environmentalist also spent 15 years working at the World Bank. Well, welcome to you all. Let me start with you, Tim Lang. I mean, you're an expert on food. This whole thing started with food in a way, didn't it? Because it started in a wet market in China, rather like some previous diseases. And now our obsession is all about food. Can we feed ourselves enough in this period of lockdown? So tell us about the importance of food in all this.
Well, I think you're right. It's exposed the interconnectedness, even in very bizarre ways. We don't yet fully know, but it's looking from the gene typing that it has come from trade in wild animals being seen as exotic, and as China has got more affluent, its pulling power of that sort of food exotica has then jumped. But zoonoses happen like this, not as bad as this, but they happen. So zoonoses ought to have been on the agenda. Here in Britain, it's already how it's emerging, this crisis that ostensibly was about bodily health, is being turned into a cultural dislocation around food. A lot of people across the sciences have been saying for a long time the food system as it's been developed in the affluent world is apparently a miracle of just-in-time delivery systems and astonishing in its complexity and efficiency. And you can go into a supermarket and see just impossible choice. And yet it can break very easily. And that fragility is something we've got to discuss, not least in relation to climate change, but also culturally.
Gail Smith, if I could turn to you. I mean, what we heard Tim describe there is something that's become very familiar. Everyone for themselves, or a lot of people for themselves in the supermarkets of the world, but also countries acting for themselves. Now, you dealt with the American administration's response, but also to some extent the global response to the Ebola crisis a few years ago. Are you worried that we're sort of turning in on ourselves as countries, or could there actually be some kind of greater global response to this issue that we're not seeing so far?
I think we need, and I hope we will see that global response, and here's why. You know, Tim referenced our interconnectedness, our interdependence. That's a fact. It's not an opinion, and we need to be much more deliberate about that. We're seeing, for example, now countries all over the world scramble to get the protective gear, the medical supplies that are needed. That's grossly inefficient, and it's not working very well. The second reason this is really important is this really is a global pandemic. Now, it needs global cooperation for the simple reason that a virus doesn't stay in one place, and we will not have succeeded in this fight if it is still raging in some parts of the world. And we're seeing already as it moves around the globe, we're seeing it moving into countries in Southeast Asia, into Africa, into places where there are some capacity constraints. And we need to be focused on that. And it's to our collective benefit.
Now, you dealt with the Ebola crisis, which was a really serious crisis back in 2014. But where was the global response to that? Did we learn any lessons from the Ebola crisis? And if we haven't learned those lessons, to what extent are we now paying the price?
I think we learned a number of lessons from that, and we would not have succeeded in bringing that epidemic under control if there hadn't been massive collaboration at the international level. I think the other thing we learned, and the world has frankly not paid enough attention to, is that there are a number of gaps in the system that enable countries to prevent, detect, and respond to these kinds of global health threats. There are holes in the net, if you will. There is one place where there is a lot of global collaboration, and that's among scientists and medical professionals. Are sort of disease detectives, are sharing data across borders all of the time so that we know more today than we did yesterday.
Let me turn to you, Inge Anderson. Your expertise is climate change. Is it not possible that this extraordinary world that we're all living in now under lockdown, has put the Extinction Rebellion crowd out of business? This is kind of what they dreamt of. No more planes, a dramatic decline in production.
Anybody who wants to take a victory on this one, on the side of environmentalism, is in deep, deep error. Because what we need to do clearly is we need to first of all understand where these diseases are coming from. They're coming from our mismanagement of nature. They're coming from us not understanding fully what illegal wet markets deliver, what illegal wildlife trade is. There is an agreement around this to manage illegal wildlife trades. Secondly, on the biodiversity front, we're eroding, overpaving, causing degradation of biodiversity. We're fragmenting biodiversity. And we know, anybody that works on nature knows that this is where we get this transmission, the zoonotic diseases that Tim referred to.
Gail, these are really big questions, and one hopes that there are people thinking up the right answers at the moment. But at the same time, we're all kind of just trying to stay healthy, and stay alive, in our own homes at the moment. So maybe this is not the time to have these big thoughts. But once the moment is gone, once this crisis is over, is there anything to suggest that we won't just slip back to business as usual?
Well, look, it's my hope that tragically this is going to be so costly that it's going to cause leaders to rethink. I do think it's going to be absolutely important that leaders hear from the people who vote for them, because we are all in our homes trying to be safe and protected, because quite frankly, global leadership has failed to prevent and manage this in the right way.
One of the big issues coming out of this is not just a really deep recession, but possibly a global depression. Worse, some people are saying, than everything we saw in the 1930s. So, surely that is going to be perhaps an even greater cost for societies than being exerted currently by the virus itself. And the political consequences of that, if they're anything like in the 1930s, are pretty grim, aren't they?
Yes, extremely so. And I think one of the things we have to remember, and all of us are seeing this in our own communities, this virus strikes hardest at those people who have the least capacity to withstand it, right? The world's most vulnerable. We're going to see epic consequences. I can only hope that this is going to force leaders to wake up and to step up. And it's also going to empower and enable citizens and, frankly, the media to demand a different debate and a different approach.
Is the world going to be a better place once this is over? Yes or no?
It's going to be a sad place for a while, but then it'll get better.
Gail?
I would agree with Inge. It's going to be rough for a time, but we're going to come out stronger and wiser.
Tim?
Yes, if we push for it. It all depends whether we push for it.
Tim Lang, Gail Smith, Inge Anderson, thank you very much for coming on the programme. Some cautious optimism there to end on. It is called the novel coronavirus, and everything about our new indoor lives is indeed novel, unfamiliar, unimaginable just a few weeks ago. But we're going to have to get used to this. We're in this for the long haul. So we need all the kindness, ingenuity, flexibility, imagination, and humour to work around it. And let's face it, for now, we really don't have a choice.
What a wonderful world. The colors of the rainbow, so pretty in the sky, are also on the faces of people going by. I see friends waving hands, saying, how do you do? They're really saying, I love you. I see babies cry, I watch them grow. They'll learn much more than I'll ever know. think to myself, what a wonder